Hello everyone. So today I will talk about Verapamil. So all the information which I will share in this video will be from the Australian Medicines Handbook. So let's start. Verapamil is available in the Australian community pharmacies on different names like Isoctin and PIC, like Cardilox SR. So these are some of the names. Now, what is the mode of action of this drug? So it is a calcium channel blocker. It belongs to a class of drugs like diphenyl alkylamines. It has equivalent action on cardiac calcium channels as well as the vascular calcium channels, and it blocks the calcium channels equivalently and decrease the cardiac output and decrease the blood pressure. So this is the mode of action of verapamil. Now, what are the indications of verapamil? So it is used as an antihypertensive drug. It is used as an anti-anginal. It is used for the cluster headache. It is used for the atrial fibrillation. It is used for the atrial flutter. It is used also for the supraventricular tachycardia. So these are some of the indications for verapamil. The dose of verapamil in angina is, if you are using a conventional tablet, so the dose is 80 milligram 2 or 3 times daily, and the maintenance dose is 160 milligram 2 or 3 times daily. And the dose, if you are using a control release tablet, then the dose will be 180 to 240 milligram once a day, with a maximum dose of 240 milligram twice a day. Now, what is the dose of verapamil in hypertension? So the dose of verapamil, if you are using a conventional tablet, then the dose will be 80 milligram 2 or 3 times daily, and the maintenance dose will be 160 milligram 2 or 3 times daily. But if you are using a control release tablet, then the dose of verapamil in hypertension will be 120 to 180 milligram once a day, with a maintenance dose of 240 milligram once a day, with a maximum dose of 240 milligram twice a day. Now, what is the dose of verapamil in the prophylaxis of cluster headache? So the dose is 240 milligram once a day, and the usual daily range is 240 to 960 milligram in 1 to 4 divided doses, depending on formulation. If you are using a conventional tablet, then what will be the dose of verapamil in supraventricular tachycardia, atrial fibrillation, atrial flutter? So the dose will be 40 to 80 milligram 2 or 3 times daily, and the maintenance dose will be 160 milligram 2 or 3 times daily. But if you are using a control release tablet, then the dose of verapamil will be 120 to 240 milligram once a day, with a maximum dose of 240 milligram twice a day. So if you are using an IV injection, then the dose is same in all these three conditions. The dose is 2.5 to 10 milligram over 2 to 3 minutes. This drug is also available with another drug which is trendulafril, and the strength is 2 by 180 and 4 by 240. 2 milligram is trendulafril and 4 milligram is also trendulafril, and 180 milligram is verapamil and 240 milligram is verapamil. So that is all about today's topic. And if you have any question in your mind, so you can please ask in the comment section and I will answer to you. Thank you so much.